application of the extended short thumb spica. Use the Exos measuring tape to select the proper size brace. The ESTS may be placed in the oven without tenting. Heat the ESTS for 3 minutes at 200 degrees Fahrenheit. Gently apply over the thumb and hand. Place the patient's thumb into the desired position. Gently pull the underlying tab to remove slack from the material in the palm. Secure the hook and loop tabs over the bifurcation of the thumb. Gently mold into the desired position. Make sure not to grip too tightly around the base of the thumb, as it will tighten the aperture and can make it difficult to remove the brace comfortably. The ESTS should be firm in 1.5 to 2 minutes. The thumb section can be trimmed to the desired length after fitting and can be trimmed warm or cool. If the preference is to trim warm, first remove the brace, then soften using either a heat gun for 1 to 2 seconds or a good hair dryer set on high heat for 10 to 15 seconds at close range. As always, please give each patient the care instructions included with their brace. Carefully review the physician's protocol for brace adjustment and removal. If the patient will be allowed to adjust their brace for swelling or atrophy, or remove their brace for cleaning or gentle range of motion exercises, then instruct them on proper donning and doffing of the brace. Periodic cleaning of the brace and skin are critical for hygiene and odor control. If brace loosening or removal are allowed, instruct the patient to wash the inside of the brace thoroughly with antibacterial soap. Rinse thoroughly with water and dry using a hair dryer set on high volume and a cool or warm setting. Dry both the brace and the skin until they're thoroughly dry.